In this second of the two-part series where we are discussing about the role of the family in helping someone who has addiction or drug abuse problems, I would like to talk about the role the family plays when the person checks into treatment, checks into rehabilitation. In the first part, I talked about how the family reacts and prepares to take action when someone is noticed, a member of their family is noticed to have a drug abuse or a drug addiction problem. So now in this second part, the family has already made a diagnosis. They have noticed that one of their own has a problem and they have decided something has to be done. And they're thinking about many options, including going into a rehabilitation center, like Fountain of Hope Treatment Center, where I'm talking from. So, when that time comes, what role does the family play in the treatment of their loved one? Just to go back a little bit, we said in the previous videos that when you notice one of your own family member or friend has a problem with drugs of recreation, drugs of addiction, alcohol, marijuana, miraa, prescription drugs that can be addictive, you need to do the right things in this order. Recognize or diagnose the problem. You take action and you support this person through the recovery process until they're strong enough to walk on their own. So recognize or diagnose, act, and support. And so in this second part, we will talk mainly about the second part, which is act, and the third part, which is support. Because the first part of recognizing or diagnosing was dealt with mainly in the first part of this series. And so, when you have known that one of your own has got a problem, how do you act? The first and foremost is talk about it. Bring together members of the family or friends who can form a support group, what we can call a coalition of the willing, coalition of supporters. Bring together these people, have a meeting, and discuss that one of our own, our friend, our relative, has got a problem with drugs of addiction and has gone overboard, has crossed that fine line that distinguishes responsible use and addiction or abuse. And in this meeting, discuss what you need to do, who needs to play what role, so that the effort is shared in the group, in the family. Now, the actions that flow from this diagnosis, we said in previous videos, would be that this person who is in addiction or abusing drugs will need to be supported, and this support will have to come from outside of themselves, because once someone has got into abusing or getting addicted to drugs, most of the times they're not able to help themselves. And so someone has to come and take a lead. So if you let this person who is in addiction be in front, you will not move well. you have to go in front of this person and help them. You could do that by acting as an elder, as a counselor, as a peer who supports. And you could talk to this person, find out what is going on in their lives. Are there things that are making them lose control of themselves and abuse drugs? Because as we've said, it's not normal that you drink alcohol until you black out. The following day you do the same, and you are missing on obligations at home, at work. You are being threatened with being sacked, being divorced, being suspended, expelled from school, or you've gotten into accidents, and still that does not startle or shake you in any way. There is a problem somewhere. So discuss, try to find out what could be the problem. Why is this person losing control? Because more often than not, they were never like that. So something has happened. And so this could be an elder, someone who is respected in the family or by the person who is abusing these drugs. It could be a peer. And if you choose a peer to talk to this person, try and find out what's happening so that they can see how to help them. This peer must be someone who is positive. Do not choose on a peer who is a drinking buddy of this person or someone who this person looks down upon. No, it must be someone who the person in addiction holds in positive regard. And this person, this elder, this peer will talk to this person and find out probably they have got some problems, social problems in the family, marital problems, financial problems, some psychological problems, present or past, okay, work-related problems, some health problems which are worrying them and they have not disclosed. These things can drive someone to a point of losing hope, despairing, and starting to abuse drugs as a coping mechanism because of the intense stress. You may also detect that probably this person has a mental illness. They're suffering from depression, or they are not functioning mentally the way you would expect, and this could be the reason they're doing this behavior of abusing drugs, because their awareness that they are going into a bigger problem may not be there. So these actions can be done at family level. You can also bring in someone who is respected and is external. For example, people go for religious leaders, a pastor, an imam, or a minister of the church, of the mosque, of the synagogue. And these persons, because they have training, most of the religious trainings have got a big component of morality, positive living, good behavior, family values. So they have skills to talk to this person and try to make this person see that whatever they are doing is getting out of control and something needs to be done. All these actions I've mentioned at family level need to be done with the realization that you're moving forward and never stagnating or going back. So you exercise what we call tough love, which I'll talk about in detail a little while from now. But the point is that once you've made a decision that you have to act, then you cannot flip-flop. You need to move forward so that you reach a conclusion. And if at the family level you can make the person who is degenerating into addiction realize that I've gone astray and I want to change, then that is something that you want to explore until they have changed and they are no longer at risk of abusing drugs, of recreation drugs, of addiction. But if you see that your efforts at the family level are not bearing fruit, there's still another level. You seek professional help, you come and see Dr. BMS. And many of my colleagues all over the world, we've got rehabilitation centers, we've got professional counselors, we've got mental health doctors, experts, therapists, and all these people can help to find out what the problem is and what therapies can be applied to help your person, your family member. As I said in previous videos, the treatment for addiction rehabilitation is multi-sectoral. It is collaborative. It's never just Dr. BMS alone doing it. No, you have to work with colleagues from other specialties. You need a psychiatrist if you think there's a mental health problem. You need a psychologist to look at behavioral problems. You will need a counselor to guide this person from the wrong way of behaving into the right way. You will need a doctor to treat other bodily problems that may accompany the addiction. You will need social workers to find out if there are any social problems and how they can be remedied. So it is normally a combination of experts working together to deliver the therapy, and so they are available for you to use them if your intervention at the family level has not worked. But above all, you must act and move forward. And so if you have then moved and you've decided it's not helped talking at the family level, you've seen an expert, professional help, and they have recommended rehabilitation, what then is the role of the family when this person has to check into rehabilitation? The family has a role to play when the person is in treatment and after the person completes treatment. During the time of treatment, the family plays two main roles. The first one is to keep that person committed to treatment, following the treatment, staying in treatment, by encouraging them, by telling them, it's all right, you need to go on, you finish, we are here to support you. Because some of these people, when they check into rehabilitation, they may still be undecided, they are wavering, some of them have been pushed into it against their will. And so if they are not supported, they will most likely lapse out of the rehabilitation. Some even escape, others just declare and decide, I have to leave, and they come and knock on Dr. BMS door and say, I have to leave. And if the family is also wavering in their resolve, it becomes very difficult for me and my team to keep someone in rehabilitation when the family is feeling like maybe he should just go home. I think he shouldn't be forced to stay here if he's not willing. So such kind of a half resolve in treating addiction rehabilitation, the family is best advised to avoid it. And that's why I talked about the coalition of the willing at the beginning. That's why I talked about a meeting within the family so that these decisions are made early, and when it comes to the execution, there is no ambiguity, so that the treatment is completed and all that needs to be done is supported to be done. In this regard of supporting the person by emphasizing that they stay in treatment and they complete treatment, the family also has a role of listening, consulting with the therapist so that they are on the same page. Because I have observed sometimes in rehabilitation that there comes what I could call false positives on the part of the person who is in rehabilitation. What I mean by this is that a patient comes into rehab, they were very sick, they could hardly walk, they were vomiting, they were not able to eat, they have lost weight, they're looking just very sick and miserable, withdrawal symptoms. And we start the medical therapies, which are usually the first ones. We are treating withdrawal symptoms. We are giving them supplementation to improve their nutrition. And after a while, this person starts to come up. Their appetite is good, they're eating, they're starting to gain weight, their strength is there, their mental functioning, memory, lucidity of the mental faculties comes. And soon the family comes and says, he looks good, now he's okay. And they start planning to remove this person, because they have seen those positives, which I'm calling false positives, not because they are false per se, but they are incomplete. This person is not cured just because they are looking healthier, because remember, the problem that brought them was primarily a mental or psychological problem which made them abuse drugs. And if it has not been resolved, they are likely to go back to it, even if they appear to be physically okay. And so it's in consulting with the therapist, planning together, that families can realize that, what we are saying is not the full picture, and we need to continue until we finish. The second role of the family, the two major roles I mentioned, the second role of the family when the person is in rehabilitation is to participate in their care through what we call the family therapy. The family therapy is a forum, an aspect of treatment where the family engages with the person in treatment and their therapist to diagnose, to find out what issues, social, psychological, financial, cultural, even religious, political, anything that could be contributing to this behavior. And so the family therapy becomes a very, very important part of therapy, when the person is in rehabilitation. And in family therapy, sometimes we come across issues that are eye-popping, big. There was a big family feud which people didn't know. Someone who is in addiction has a big vendetta against a member of the family. They feel strongly about something that happened in the family which has affected their morale, it has affected their ability to function, and it's only in those forums that these things will come out and they can be discussed openly and conclusively, because the environment in rehabilitation affords that. It's a neutral environment. It's being moderated by professionals, and we are able to know how much can be given out at every stage so that we do not disrupt the whole recovery by maybe occasioning a family fight or something. So it is moderated, it is controlled. The person who is in recovery also has improved. Their mental functioning is better than when they came, because some of the patients in addiction have got serious mental health challenges, sometimes even memory. They don't remember things. They cannot reason well like someone who is not using drugs. So if you try to solve a family problem, it's a disagreement over land or inheritance or something, infidelity, whatever those things that come in family therapy, you're talking with someone who cannot really reason well. So when they come into rehabilitation and Dr. BMS has given them his magic injection and now they are thinking better, their mind is clearer, and the ability to recognize, remember issues is better, that's the time then these discussions can come. So it's a good opportunity to come and support this person and discuss these issues in what we call family therapy. We normally recommend that you bring in people who are positive. Don't bring in people who are going to cause more acrimony. Come with those ones who are supportive, They want this person in treatment to heal. They show love, compassion, care for this person. And slowly we can work from the easy things to the hard things as time goes. Also, during this time, we recommend the tough love that I talked about. That the family coming in to support during family therapy or even just during visitations, you want to correct everything that needs to be corrected to bring this person back on track. So you're going to be truthful, okay? But you are going to be gentle. You're not going to talk or behave in a way, a rough way that hurts that person's feelings and makes them feel like they are still unwanted outcasts. At the same time, you do not want to cover issues that need to be brought out and discussed. So it's a very fine line you want to walk. We call it tough love, that you're being tough, but you're being loving. And so you bring out the issues that need to be brought the best way possible with a view of finding a solution. At the same time, it also requires that the issues that make this person remain weak and in that behavior of addiction to drugs, you avoid them, you stop them. And these issues, I talked about them when I mentioned enabling and codependency in part 1 of this series and in previous videos. So you want to change behaviors that enable this person to continue in this destructive behavior of addiction. Families also, as they do those two major tasks while the person is in rehabilitation, we advise them to manage their expectations. This person you've brought in is sick and they are recovering. Recovery takes time. Some of the issues that you are trying to treat have been there for many years. They're not going to be resolved overnight just because the person has come into rehab. So you manage expectations and you allow slow and steady growth and recovery. When the person leaves rehabilitation, usually after 3 months in our setup sometimes, even if it was outpatient rehabilitation, once they finish that period of intense contact with their therapist, they go into what we call the after rehab or the aftercare program. And this is a period where someone is like half cured. They have more awareness of what the problem was. They have a bigger resolve to change it. They know more things about what needs to be changed. The situation around them, the family and the others are more supportive, more aware because you've had family therapists and many other things. And so the ball has started rolling and this person then is let out to start being on their own, but with support from us, the therapists, and support from the family. And so for the family, the support which you need to give, which is the topic of our discussion today, is that, sorry, a little cough, is that continue exercising understanding of the gradual nature of recovery in the rehabilitation or addiction setting. Continue exercising that tough love where issues that are important are addressed firmly but lovingly, and you avoid things that can make someone go back into the old ways, the enabling and the codependency. This another thing I talked about in part 1 of the video, that people may shy away or be reluctant to check into rehabilitation because of guilt and shame. The family can support this person who is out of rehabilitation by not perpetuating the guilt and shame. That pointing fingers, that saying, you used to do this, it was like this, taking this person back to the past, even when it's unwarranted, is one form of perpetuating guilt and shame. You need to forgive and forget. You move forward. You don't move with baggage of the past, which you keep referring to, because it makes this person feel like nothing has changed, nothing will ever change. So even what Dr. BMS was telling them in the rehab is not true, because when they came home, things had not changed. In Kenya, we say, kwa ground mambo ni tofauti. They came out and it was just the same story from family members, and they feel like it's a hopeless situation. So you want to not to perpetuate guilt and shame. You support this person also by helping them, steering them to join support groups. We normally refer these people to support groups. We have the international support groups like Alcoholic Anonymous, Narcotics Anonymous. They have many chapters in Kenya here, especially in the urban areas. They meet every week and they support each other. This is a grouping of people who are recovering from addictions and abuse of drugs. They have changed their ways, so they support each other. As a family, you want to encourage your loved one to be a member of this, because they provide the support. And one of the key things they do is what we've discussed in the past as PPTs. It's a big concept in rehabilitation. PPTs, P for people, the second P for places, and T for things. When someone has to change behavior, including addiction to drugs, which is in part a behavioral thing, you need to change the people you relate with, the things you do, the places you go. So you cannot leave rehab and start associating with their drinking friends, some of who are still drinking. You continue going to the clubs, to the parties where alcohol is being served and miraa is being chewed. Your resolve will not hold. You will fall. Okay? So by the family supporting this person to go and join support groups, they're also steering them along the line of PPTs, people, places, things, and this helps this person to be stronger in their resolve. Finally, as I said, you avoid enabling behavior. I said you avoid perpetuating guilt and shame. Also, avoid perpetuating enabling behavior when this person comes from the rehab. This means they come home, you want them to be responsible for this and that, for their actions. You want to hold them to account, lovingly, but family, tough love. But not that you want to look the other way. This person has started doing things that make you uncomfortable, or not doing things that you expect them to do, and this is making you uncomfortable. And you cannot just ask or discuss this because you feel maybe this will provoke their anger, it may make them relapse. No. You are starting to bring back that aspect of enabling and codependency. We want you to be firm, fair, and loving. And so this person should know that they are responsible for their actions. Their family loves them, supports them, is watching what they do. They would like to know what is happening, and they're entitled to find answers, to ask questions, and to get accountability on the part of this person. Then as this person gets strong, we'll have discussed in the rehabilitation center a plan of what needs to be done. This is a big part of our planning for discharge. We'll have discussed what activities they're going to do. Someone may be going back to school, maybe self-employment, or it is employment, their employer had given them permission leave to be in the rehab, and now they're going out. So that plan that we discuss, you as a family also need to follow up on this plan with this loved one who's just left rehabilitation, so that it is fulfilled, because it's in the fulfilling of that plan alongside the other things that we have discussed that this person can truly change and start on a new life that does not involve the usage of drugs. Thank you, and I hope to see you again in the next episode of Dr. PMS. Remember to like and subscribe our channel, like our videos, share with a friend, and ask the friend to share with a friend. Spread the word, because this is what makes us better: the knowledge, the awareness about these good things that we discuss on our channel. Bye bye.